Physicians, new hope for difficult patients. Novel adjuvant. Patients and adjuvant means add this to your existing medications for delta-6 desaturase compensation, COPD, asthma. EZtrek is a unique new medical food. Peskin Pharmaceuticals, the green drug company, plant-based oils. Physicians Turbocharger Protocol, supporting and optimizing your patient's natural physiologic processes. No blocking or impeding. COPD, physician self-patient. Quote, diagnosed with COPD over 10 years ago. Mine's from lupus, chronic bronchitis. I'm stage 2. Also have a history of pneumonia over the years. Been taking albuterol for 10 years now, plus Symbicort and prednisone. Over the past few months, I have struggled with shortness of breath, wheezing, and coughing. When I started EZtrek, within an hour, I could feel my lungs opening. Over the first week, I could feel myself able to take a deeper breath and expand my lungs. Over the past 2+ weeks, I've reduced my prednisone from 10 milligrams to 2.5 milligrams a day. No longer using my albuterol, still on Symbicort. I have more energy and able to walk without being winded. My blood pressure is normal now, and pain has reduced completely. COPD with fibrosis, scarring. Quote, 54-year-old female, history of smoking less than a pack a day for 20 years, diagnosed with COPD 3 years ago, put on several meds, history of COVID-19 which caused damage to lungs, pneumothorax with collapsed lung that required hospitalization, CT showed significant scarring. Pulmonologist was guarded on any improvement, stating, your case is grim. She has labored breathing, required 24-hour oxygen. On February 28, 2022, she saw a pulmonologist, had a CT PFT evaluation of lungs that showed obvious positive changes. She has only been on EZtrek for 1 month. Her pulmonologist was pleasantly surprised. She no longer requires oxygen and can now speak and move about without being winded. Nothing else changed other than adding EZtrek. COPD with fibrosis. Scarring. Patient is brother of MD. Quote, my brother, 64 years old, afflicted with COPD for the past 10 years. Oxygen supplementation for the past 7 years, 24/7. Currently is in stage 4 COPD. Becomes fairly short of breath after taking a few steps. He has scarring verified by CT, waiting for lung transplant. Started using EZtrek 6 weeks earlier. I can tell you he is definitely feeling better. Still uses his oxygen at 4 to 5 liters a minute, but his moaning and crowning is much less, and his labored breathing has improved after taking a few steps to the bathroom. Complicated diagram? 2 important points. On the top in red, delta-6 desaturase. If there is an impairment here, every pathway's output is decreased on both the left side and the right side. PGE1 in red. PGE1 is the body's #1 anti-inflammatory, hence PGE1. It is also a vasodilator, increasing blood flow and increasing associated oxygen. On the right side, the medical journal article extensively references inflammation and COPD. Envision harmful delta-6 impairment, then unknowingly making inflammation even worse. Highly technical, but very important. Quote, according to this new mechanism, the unfolded protein response is activated not only by misfolded proteins, but also by anomalous, irregular membrane lipid compositions. EZtrek is a highly specialized lipid composition. The study provides a new perspective on the active role of biological membranes, may be a game changer for the understanding of a great variety of diseases, leads to UPR activation that can trigger long-term stress, chronic inflammation in cells, both unfolded proteins and aberrant deviant membrane lipid compensation. Lipid compositions are sensed. Inflammation is increased. Question, where does this anomalous irregular lipid come from? Answer, processed oils and food served in restaurants, fast food, prepared foods, snacks, etc., unavoidable in today's world. Every time you eat, you can be causing inflammation. Physicians, turbocharge your protocol with adjuvant medical food EZtrek, exclusively distributed by Good for Health, goodforhealth.org. You can see how to stock EZtrek for your patients. Patients, if you need a Delta 6 evaluation, see goodforhealth.org, the patient portal for a telemedicine physician. Appendix, a multitude of referenced scientific medical journal articles detailing impairment of Delta 6 leading to decreased output of anti-inflammatory PGE1. EZtrek, the unique new medical food designed to combat inflammation to help you breathe.